So CERCA is a coalition to end racism through clinical algorithms. Race is often used as a biological construct, and it's inaccurately used that way because race is a social construct. Because of those practices and historical injustices and structural racism, a lot of the fabric of what we teach and how we practice includes some of these things in our actual decisions when we're in front of patients and how we treat them. And so we're here to start dismantling that, and that we're actually doing the work to be held accountable as systems, as people, and how we show up for our patients.
Black New Yorkers are disproportionately affected by diabetes, hypertension, obesity. All those chronic diseases lead to other chronic diseases, including chronic kidney disease. And that's not okay, because we know we can diagnose people earlier. We know we can help people live better lives. And that's what CERCA is working on, is really getting people the access that they need and deserve.
As a transplant nephrologist for the last several years, we definitely see day to day the stark disparities in who's getting access to transplantation, and there's a lot that I think can be done to try to improve that. And so I'm really glad to be able to share some of my experiences as a transplant nephrologist and what I've seen in not only the referral process to transplant centers, but also the initial evaluation processes.
I had been in North Carolina for about 20 years. I am new to the New York City landscape, new to be part of this discussion, and incredibly excited to bring those past conversations about doing some of this work in a Southeastern context with different political dynamics and other shifts, and hopefully doing that work meaningfully here in partnership with communities that have been doing it for a long time.
This is the place that I want to be, because I want my voice to be part of the group of people that are clamoring for equitable practices and respectful practices in birth and all areas of healthcare. And I do believe that when it's equitable and available to everyone of every background, it'll uplift healthcare in the United States for everyone.
I'm just looking forward to figuring out ways that we can dismantle the social construction of knowledge and really get back to the basics of science instead of trying to put racism into medical perspectives, which doesn't give anybody a fair chance at anything.
If you know that you're in a group of like-minded people, you create a community which creates strength and resources and resilience, and I think that's what we're all here to do, to learn from each other and figure out what are the best ways to move this agenda forward. Being able to talk to people who have those different experiences and figure out what of that you can bring into the work you do to be more effective is really like crowdsourcing. You can't do it alone.
The future of CERCA is hopefully to get folks understanding that race is not a biological construct, right? That we shouldn't be using race in the way that we're using it in terms of biology, that we're supposed to be using it because there's injustice around how people are taken care of. And hopefully this will start a trend that other institutions or other states, other entities are working on questioning whether or not care is being delivered with race essentialism in mind, or thinking of race as biology in mind, as opposed to using race to understand why there's inequities in their systems, in their communities.
We have to, figure out a way for everyone to be treated the same way. All we are asking is that everyone be treated fairly, and that's it. Whether it's medicine, non-medicine, social determinants, whatever it is. The simple approach is that we look at it in a simple way. Everyone needs a fair chance.
CERCA's efforts can lead to healthier people, less chronic disease, better diagnosis, early screening, better access to healthcare. I really believe that it takes a village, and this is the village, and I'm so honored to have been invited to the table because these are the people who are going to make a difference.